it's not just the patient's fears that are entering the room. It's also ours, both for the patient and then also what we're navigating in that moment too as healthcare professionals.
I know even for me, fear that I would bring to the table, am I going to figure out what's going on? Or is this person just going to have this amorphous thing that continues to affect them?
In the top 10 phobias, 3 out of the top 10 actually relate to healthcare. What we know with anxiety is it is associated with actually higher healthcare use, but actually worse outcomes. As physicians, we don't always get it right with what our patients are fearing.
What might be some ways to push forward as the patient or as just a general person out there trying to figure out, what do I do with this healthcare-related fear?
I'm Dr. Laura Sidari, board-certified psychiatrist.
And I'm Dr. Tony Sidari, board-certified rheumatologist.
And welcome to our podcast, No Cure for This, giving you what to say for medicine and life when you have something you can't fix. And all you can do is cope, adapt, laugh, and keep showing up. We're here for the stuff that isn't a guideline. We'll talk about burnout, stress, relationships, and everything in between.
Although our work as physicians informs these discussions, this podcast is not for treatment purposes, and any descriptions of patients' situations have been modified to protect confidentiality. For any direct medical advice or treatment needs, we recommend you seek the care of your healthcare provider.
When it comes to our health, fears can often enter the picture with the realities that we're facing, but also the unknowns that we haven't yet faced. And we know that fear is a natural part of being alive and being human, yet it can become a problem when it interferes with the ability to live the way that we want to in alignment with our values. So in today's conversation, we're going to be taking a look at what do we fear related to our health, and how does that show up for us as people? How does that show up with us as patients navigating healthcare systems? And what can we do also as healthcare professionals facing our fears and helping patients to navigate that towards better health and healing? What are some of the things that you think we fear as people related to our health?
I would guess, if I said maybe the top 3 fears that I would think people have related to health, maybe mortality. So like, how long am I going to live if I have a medical problem? Maybe like, how is this going to affect that longevity? Maybe second, I think there's probably rightfully so a lot of fear about things like cancer. So cancer would be one. And then maybe just third, like fear of chronic conditions or chronic disease that might impact like your ability to function or interfere with, what you otherwise want to do in life. Is there any sort of like studies on this kind of topic that you know of?
I was looking up a little bit of that because although as a psychiatrist, I work with people with a lot of fears, I was interested to know too. So for adults in particular, 2 of the top conditions that people fear are no surprise. What you shared, cancers and dementia are 2 of the top ones. Another really interesting part that I came across related to community studies on phobias. So looking at people who have irrational fears that are interfering with their day-to-day life or causing clinically significant distress. What surprised me is that in the top 10 phobias, so when we look at things like fear of heights and fear of water, those are some really common phobias. 3 out of the top 10 actually relate to healthcare when it comes to health-related fears. So what do you think those 3 might be?
Top 3, this is probably me speaking for myself, but I would say maybe surgery, getting surgery done, going to the emergency room, and maybe going to the dentist. Those are probably my top 3 medical phobias, I guess, if there was one.
I would agree, like we would expect medical situations, but actually the way at least it was phrased, in this paper was fear of doctors, healthcare professionals, dentists. Yes, were on there, and they were a little bit above.
Sorry to
doctors.
dentists.
But
Everybody
blood.
fears the visit.
That's a fear of mine. I love my dentist. She knows that I get really nervous when I go to see her. And blood and bleeding actually are a top fear. And it ranks just a little bit below things like fear of heights for the general public.
I mean, I can see why the medical professional one would be top, since there's so many things that can pop up in an office visit that would be unexpected. The dental one makes sense. It's like kind of like a reverse slot machine. You know, if you go to dentist and you feel fine, you could find out that you're going to get a root canal, or you could find out that you're great, and you never know. And then the blood one, I guess I get that. I guess it also doesn't bother me, but it's like something outside the body that's not supposed to be there. It's like, yeah, that's pretty. Some people have a pretty visceral response to that. So
we see that even with people that we trained with. I can remember we had a blood draw part of medical training, and you really do figure out who has a fear of blood based upon who's the first one to pass out in the lab.
Always somebody starts teetering back and forth, and you just kind of say, go take a seat. But how do these show up like like say somebody's trying to work on their health, and maybe they're going to the doctor. How does either the fear or the phobia side show up, like in the midst of that? Like, what do we know about that?
I think it's important to keep in mind that when we have health-related fears, we could have the same fear, but a different reaction to it. So for some individuals, avoidance takes over. So these are going to be people that have those, let's say they truly do meet criteria for a phobia. It's irrational and it's persistent. We're never going to see them in our office.
So they just don't come to
They're not
seek
going to
care.
show up. We may see them when it's something very severe. So thinking about in the emergency room or being brought to the hospital. However, they're going to be less likely to seek care, especially for everyday preventative care. Which avoidance can be a helpful coping mechanism in some situations where it can be protective. But if you think about it interfering with you getting preventative care and getting you the care that you need early, it could actually hurt your health.
I think in some ways that shows up as like it's kind of almost a coping of denial that we see in some patients and folks that are trying to figure out their health situation. I mean, I've known people who, when I'm dealing with, say, somebody who's had a condition that we treat a lot in rheumatology, rheumatoid arthritis, it's kind of in the name, where the joints become at first really swollen, but then really, like over the years and decades, becomes very malforming and deforming of a condition because of the damage. And very rarely, we still meet people that have had that going on for a long time. And I'll just kind of say, essentially I'll ask them, where have you been? Like, what kept you out? Because there's no way they thought that was normal all that time. And I've heard varied responses, but I think the most common one that I've heard in that scenario is just, I didn't think it was time, and now is the time, because it's caused that kind of, like you're saying, that kind of issue where, well, now my tendons have snapped in my wrist, and clearly something has to be done. Kind of got past the threshold that the avoidance couldn't keep them away anymore.
Yeah, especially for people who look at hard work as like the way that we overcome anything, or they view it that maybe it's a sign of weakness to seek help, or maybe they're concerned about the navigation of the healthcare. There's lots of things that can interfere with that when we think about ourselves too. So on a given daily basis, you have all sorts of different bodily feelings that you're going to have. You're going to have little aches and pains. Part of a way to cope with those things is to be able to also ignore or put aside some of those and focus on other things. So when it comes to health-related fears, sometimes we don't see it until it's right there in our face. And sometimes those health-related fears can keep us from seeking help sooner or being able to recognize it sooner, because we're also, it's not in our area of awareness either.
And how about for clinicians, like people providing care?
Different from a typical psychiatrist, most of my work is in integrated primary care. And so a lot of times my clients are not the patients themselves. It's actually the providers taking care of the patients, the physicians and the primary care clinicians that are taking care of the patients. And so when we're taking care of folks, there's part of the fear that relates to what the patient is going through. So there might be that clinical question of like, what's going on for this patient situation and how can I navigate it? And then part of it is also sometimes our fears that show up related to being somebody trying to help somebody navigate their health. We know that as physicians, it's not typical that you go into healthcare, become a doctor if you don't want to help people. So those fears, not just for kind of what the patient is bringing in, but also what we're bringing to the table, like, what if I miss this condition?
Well, I think we get trained on, and you look at the testing we go through and just like clinical scenarios where we're being, quizzed on the inpatient wards and whatnot, where diagnosis is king. We need to figure out our differential diagnosis, which is trying to know what are some competing theories of what could be causing the underlying issue at hand. But then ultimately it's finding a diagnosis and finding a treatment. I mean, those are like the underpinnings. And so, I mean, I know even for me, fear that I would bring to the table as the clinician is, am I going to figure out what's going on? Or is this person just going to have this amorphous thing that continues to affect them? Will I be able to put those dots together? There's almost some relief when in my shoes, when I see things that are like very, very specifically associated with a diagnosis, because I almost feel a relief. I know what's going on, versus there's all this chaos and nobody has any idea, and all the testing and everything doesn't really give any sort of answer. Even we feel anxiety and fear about that as we're going through that with a patient. And then I think the same with treatment. So knowing, okay, we figured out what this is or what we think this is that's going on. Can I get this person to a place that's better? Whether there's a cure or not, whether it's an ongoing treatment or set of treatments, different things that might be impactful to help them. And then I feel like that combination probably culminates a lot of how we might react to different scenarios that come up in working with said patient in that scenario. How do you see that show up in the psychiatry, behavioral health side?
So different from that side of the avoidance. A lot of times we'll end up with people who are on that higher anxiety level where they are noticing many things about their body. And sometimes this can be related to health-specific anxieties, like there's a lot of worry and fear related to particular health conditions or a feared health condition. And sometimes it can be more generalized, like related to a lot of different areas. So on the other extreme, we can get individuals who are noticing every little part of what's going on with their body. And it's really important to note this is not made up or all in their head or just anxiety.
I think historically, it's not a term that I would encourage the use of, especially today, understanding that those things show up in that way. But, historically, I feel like they would call people a hypochondriac or essentially liken them to making them feel crazy about what's going on with their body, when, like you're saying, these are some different cues that might show up. And I think rightfully so, there's fear associated with what's going on? Why is this happening?
It's not something that you can just cure in terms of we can't cut it out. We can't just remove it. That fear is an important part of you being able to see what is dangerous or what is not. being able to pay attention to what's going on with your body. The problem is when it starts to take over and really interferes with people's functioning. So, for instance, paying close attention to what's going on in your body and checking in with your body, whether it's doing mindfulness where you're looking at the different sensations in your body and what thoughts, what feelings are showing up as well, or if, let's say, you're using things like a glucose monitor or you're using a tracking device to sort of see how you're doing with your health, those things can be helpful signs. But when we start to read into those signs, where we're spending lots of parts of our day focusing on that, and so we're not able to do the other things that are enjoyable, it can become a problem. What we know with anxiety is it is associated with actually higher healthcare use. So these are, we're going in for more appointments, we're asking for more tests, but actually worse outcomes if we are going down that physical health route and just ordering lots of tests and there's not a good reason. So this is part of why health-related fears really matter to us as people, as patients, and as healthcare professionals, that we want to hit that right altitude of paying close attention to what's going on, but not getting to that point where everything is being consumed with working up and assessing these different anxieties to the point that it interferes with us actually seeing the things that matter, whether health-related or otherwise.
I think one thing I'd like to talk about would be related to how those fears drive an interaction, like in the office. When we're seeing a patient who has their set of fears, like what is going on, or maybe they have a diagnosis and they don't know if it's getting better, maybe they can't tell, or maybe it's not improving, whatever symptoms they have aren't improving. How does the fear side drive the patient and or our end of the interaction?
That tension that you're bringing light to is so important to acknowledge, right? It's not just the patient's fears that are entering the room. It's also ours, both for the patient and then also what we're navigating in that moment too as healthcare professionals. It's important to note that as physicians, we don't always get it right with what our patients are fearing related to health. Survey data that took a look at physicians as well as patients' perspectives on chronic illness had some separation in terms of what patients had concerns about with their chronic health needs and what physicians expected them to have. For instance, key concerns for them were, I'm not going to be able to function. I'm not going to be able to provide for my family. Whereas physicians overreported compared to patients' concerns about diagnosis, concerns about dying or death, and concerns about decline in clinical markers. So this really speaks to the importance of talking about what health-related fears are and making sure we're not just assuming we know what our patients are going to be concerned about.
I think that just paints the picture of the disconnect between us alleviating our own fears about the scenario, like just going through whatever's happening for that patient, and what's really going through that person's mind, like what really matters to them, may not line up.
In your caring for patients, where do you find that balance, Tony, with navigating your sort of fears, both for them and for the care, with also what they're bringing to you?
I just start asking questions because people might say like, well, what's going on? Like, I don't know what this is yet. And I'll just say, you know what? I need to ask some more things about XYZ. Like, let's go back to what you said about this. I don't know what I don't know. And so sometimes more information can give us pieces to chip away at. I'm not saying that that's the answer, that there's some magic bullet for how you address that, but that's just how it shows up for me. I ask more questions, and I try to find some things that might be able to be chipped away at over time, even if we don't have a 100% like clinching diagnosis or clinching answer. Let me give you an example. A historical item, like something somebody tells you, something in the timeline of what's going on for them, something that you see on an exam for us as clinicians is just as important many times, sometimes more important than any imaging study or any lab that you can get. If I'm doing an exam on a knee and there's no stability and I know something's torn because the knee has complete give, it doesn't matter if the MRI comes back as normal. Something's wrong with that knee. It needs more evaluation, maybe by an orthopedist, maybe from a sports medicine doc, maybe from a physical therapist. But the image is not all that matters.
That's super important to hear, both as patients as well as physicians. The test is one part of it, but it's actually not the main part. It's everything that goes around that. So especially with healthcare-related fears, health anxieties, making sure that the tests that we're ordering, there's a real clinical reason for that. And I think as patients, part of the fear that we have going in to talk with our healthcare professionals is they're not going to believe me, they're not going to take me seriously, and they're not going to see me. So we want to be really thoughtful that just because we're not finding something on imaging or it's not captured in one of the ways that we're taking a look, it doesn't mean that it's not real. It doesn't mean that the distress is not real. I like to use the example of if, let's say, we're trying to capture the wind, a photograph is not really a great way of doing that. So your test is only as good as what it's actually trying to assess. It's not helpful with healthcare-related fears or anxieties, both normal as well as when they become a disorder, to say there's nothing wrong or to say that this is just anxiety.
In my field of rheumatology, there is a lot of lab work ordered in context. There is a lot of imaging that might come as part of that as well. It's when I've done some rheumatologic workup and it comes back as I hoped, negative, and everything looks great from that end, I will just essentially put it in, and not that this is perfect because everybody can have their own way to do this. I will put it as what I'm finding coming back is really low risk for that particular condition, this particular condition, of which could have contributed to your symptoms. I'm just not seeing that at this point. But it doesn't mean what you're experiencing isn't real. Like, I'll actually say that to people because it's important that they understand that, like, A, we believe them, but then also I want them to know that they have our support, even if I don't have like a full explanation. So that's my approach at the end part of that. That's how I try to get that message across, and it hits how it hits. You know, I don't have control over how one reacts to that scenario, because sometimes, as silly as it sounds, sometimes people really wanted to have that answer, and sometimes when you give them more questions, it can feel disoriented. But I feel like that's a helpful path that I see.
I think that brings up one of the key pearls here, that when it comes to health-related anxieties, we've got both the physician side, the healthcare professional side, and the patient side, and the way forward is through the relationship. And especially when we're in like primary care or have that continuity relationship, it's not just that one time that we're meeting with the patient that we have a chance to take a look at the symptoms and talk about it. So sharing, this is what I'm seeing right now, and this is what I'm going to do for you moving forward. Let's make sure we're continuing to closely follow and take a look at these symptoms. Or this is one of the areas that I'd like you to pay a little bit closer attention to. These are the things that would be warning signs for you to come back. It's really important to note that this is not just an all or nothing kind of thing, that either everything's normal and nothing's going on and there's nothing to worry about, or there's so much that we need to be consumed about. I think that other piece that is really important that you touched on is also that conversation with the patient. So making sure that we're asking about what those fears are and what those important pieces are. Making sure we're giving an opportunity for them to share, this is what's most important, because we have that potential and that likelihood to get it wrong and not, actually accurately understand the fears.
I think especially in someone that might have a lot of different things going on, that is definitely another area where we can be, like you were saying, in the relationship, because we've talked a lot about the patient side and the clinician side, but not like how do they integrate? And it's like just in terms of asking the question of these things that are going on, what of them has been the most bothersome? Like, what do you feel like you need to get addressed? Number 1, 2, and 3. And in doing that sort of prioritization, I feel like that's a useful practice just in terms of getting somebody to start thinking in that way. And that really may have, so when they come back to see us, they've had the chance to have that seed that was planted, that they're now hopefully like thinking like, how is this affecting me? I haven't really thought about that versus this thing versus that thing. And that's like one of those untold, it's not a treatment you prescribe. It's not a diagnostic test that was a huge breakthrough, but something that simple can make such a big difference over time.
Monitoring is incredibly misunderstood just for those reasons that you're sharing. Monitoring is an active part, and it can be active part of the relationship, actively looking for those things in ourselves. I think part of the fear that we also have as healthcare professionals is if I don't prescribe something or I don't give a treatment, am I helping that person? By sort of prescribing monitoring, that's a great way to address all sorts of healthcare-related fears in a way that the person's able to learn, how can I look at this in a way that is constructive, where I'm bringing this back for a conversation with my doctor and seeing what's the level of concern to have with each of these different symptoms.
What might be some ways to push forward, as the patient or as just a general person out there trying to figure out, like, what do I do with this, healthcare-related fear?
I just want to acknowledge it's really tricky to be in that room for each one of us when we're the patient. We're also, as physicians, we'll also be in the patient seat. Not as often as we are in the seat as the physician, but often we will find that too. And there is that power imbalance, that piece of you're coming in and you're vulnerable, you're physically exposed or emotionally exposed, and that's a leap of trust. It's important to get out what those fears are out in the open so that we can do something with that. And a lot of times there can be fears of if I put it out there, it's going to be rejected, it's not going to be taken seriously. One of the ways that I think it's really helpful to put that out there is to say, I want you to know that this is bothering me or this is a concern for me, and this impacts the way that we can engage. So just want to let you know, for instance, I get a lot of anxiety and stress when we do blood draws. This is what has been helpful for me in the past, or I'm not sure what's helpful. However, I want this included as part of us taking my blood today. It helps both sides where you're able to verbalize what it is that you're experiencing and then gives a way forward together with the healthcare professional. In these situations, also sometimes myself included, have been, diminished with the concern. I can remember right after our oldest son passed away, Leon, our younger son, Tristan, had a very high fever. And we went to the emergency room and I shared kind of the fear of, I want you to know that just 6 months ago, my oldest son passed away from flu. And this is really very scary for me to be bringing in my other son. And the vast majority of people in the healthcare team, they were more thoughtful with how they took the blood. They were more thoughtful with how they asked the questions. There was one member, though, of the team who said, and I can still remember this, just because your oldest son died of flu doesn't mean that we need to order another blood test. And I hadn't asked for that. I hadn't asked for, I want another blood draw or want another test. So it took me aback and it upset me. If I were to go back to that time in a different state, because at that point I really couldn't have advocated, I would have shared that statement was very unhelpful for me being able to work with you related to this piece with my son. What I'm most concerned about is just making sure that in your clinical impression and the team's clinical impression, there isn't something more that I should be doing here to help keep him safe. So just wanting to acknowledge that piece of when we're able to, as patients, advocate for ourselves, or we have somebody else who can help advocate for, this is what I'm experiencing, and this is what works well, and this is something that I'm hoping for. One or all of those things can help us to create better alignment in terms of how we're experiencing healthcare and what are some of the outcomes that we're going to be able to get towards.
What about for people who have had like a lot of anxiety and fear from the healthcare perspective before going to seek care, and then maybe they encounter a scenario where they are kind of feeling like they're being brushed off?
This is where I think having a patient advocate in the healthcare team, as part of the healthcare team, is super helpful. Being able to talk to somebody, if let's say you don't feel comfortable talking with your healthcare professional, can be a good way to go, because then that person's able to get that feedback. The goal of that should really be to make sure that other people don't have that same experience. If feeling comfortable and like it's going to be a constructive conversation, sharing that directly and in a way that's not shameful, because we don't want to be shaming back our healthcare professional, but rather with humility of what you shared with me wasn't very helpful for my care, and this is what I'm looking for. So let's say it's not as much like a diagnosis, but I'm looking for some strategies that I could use that could help with these sensations in my body. Those can be helpful things to share if you know what you're needing. And if you're not sharing that was not helpful, is in me figuring out what it is that I'm needing for my health.
One thing somebody could say in sort of a self-advocacy might be akin to, something that's worked for me with other medical providers is XYZ, almost an external authority of like, well, this is what's worked in the past. Maybe you could ask questions this way, or maybe somebody won't go for that, and maybe it's just like you say, it may be a scenario that needs an extra advocacy piece to help out, but just a different path forward.
If you enjoyed being part of this conversation, be sure to like, subscribe, and give us a follow. If you have any questions, topics for future episodes, or a no-cure moment of your own, be sure to leave them in the comments. Thanks for listening, and see you next time.